embabazi neyegesa ahabw'okuba twerundana hamwe omwe yaba naruka ekiibo ondiijo omukyeka ondiijo ebitambara eki waaba otarikumanya otwara idaara ry'okukyega nyowe ikanyamba ahabw'okuba omwishiki wangye akaba aine ekicuncu ky'okwega ekiharani amazima abiri yatandikire kutunga suuti yatandikire kubaziira suuti n'esaati n'empare
ize ekyo ekintu ekinjegeremu nitwija nk'abakyara twerundana twezya ebintu by'emikono tubikora tubiteeka aho kugira ngu nyensya nk'oku twafuna nk'aba abagyenyi baija bareeba ebintu byaitu by'emikono ebi turikukora babaasa kubitugurira twihamu akasente k'okubaasa kutuyamba nyowe mwena Joyce Association ningisiima
ngo birimu ebijwaro ntagobe sente nagira nti hasitu wagiresere reka turunde enkindo turunde emikyeeka tutungure ekigombe kyaitu nibyo ebyobiturikukora ebyo byo bantu bakusinga.
We started in 2023. We started with the elderly. What we do crafts, we do mushroom growing for our income, for the steadiness of our homes. The founder is Maureen Torr, Nabiimpa actually, who supports us in everything, but in future, we pray hard that we get the income so that we can sustain ourselves, like we have heard from the members. We want to make our own income so that we can grow big.
We started it in Karwenyi with about maybe 6 or 8 people. As we speak, we have over 50 members, and most of them are elderly people, and they come together, they work on their activities, they work on skilling mostly, using their hands, creating jobs for themselves and also generating income. We have a country director called Ariska Bandize. She has done an amazing job. She's a leader. She's very passionate about what she does. Joyce Center started about 25 years ago. I was inspired by my mother, who was Joy, who took care of children from our home, who used to tell us that every child needs a home, every child needs food. We were young, we didn't really understand what she meant by that. As we got older, we realized that, okay, kids are kids everywhere we go. So when she passed away, I really wanted to continue with her legacy. I decided to start an organization, and it has turned into a huge success that I never really thought we would be where we are today. We have a school, we have an orphanage, we have an outreach, we have teams in Canada and teams in Uganda. It is beyond me, and I'm so grateful to my family that have been supporting me, sponsoring children, raising funds, and trying to make sure that the kids we take care of are well taken care of, and also the staff, our sponsors, and everyone who is trying to make sure that we do our job with all our hearts and all our minds, and focusing on people, because we are Rotarians too, and as Rotarians we focus on service above self. And I am so excited that we will be having our first hospital in the entire district.
I have known Alice for 20 years. We're Rotarians together, and I first heard about her project with this Joy Center School that was developed by the name of her mother. I heard about that, I guess over 15 years ago, and I've been on the board for Joy Center School in Canada, and watching the progress and being so impressed with how she has gathered trusted partners and trusted leaders to help with advancing this project. So now we've got 275 kids up there, and we were talking about what would be the next step for the community. And so healthcare is a big need. The nearest tertiary hospital is in Emberara, which is about 4 hours away. There isn't so many services for prenatal care or for well baby care. And then if you break your arm or you have a difficult delivery, how are you supposed to get to Emberara? Because nobody has a vehicle here. So behind me, you can see what we have started. We started planning 3 years ago, and we started building in January. And I said that I would take on this project to be my legacy project. I'm a retired nurse. I've worked in the north of Canada with Indigenous people. I know what it's like to provide primary health care to a community that needs it. So we started out building a small clinic, and then as we continued talking, the clinic, it grew bigger and bigger. Now, behind me, it's going to be a 64-bed hospital with operating theater for cesarean sections, for neonatal. It will have pharmacy, x-ray, lab, ultrasound, all the things that you need to have a level 4 hospital in this community. Of course, that's a huge project, and I'm very fortunate that I can pay for the initial construction, which was about $200,000 Canadian. And then it's going to take another about $200,000 to finish the whole project the way we want it and to have the rooms ready. But we're going to have 4 rooms ready within 2 weeks. You can see that the roof is going to be finished this weekend. And with those 4 rooms, we're going to start doing healthcare for the children at the school. I'm going to do vision screening, hearing screening, skin and dental screening. And they'll get new toothbrushes when they come and have that assessment. And then we're going to start slowly with antenatal care, is what they call it here. Prenatal care with prenatal visits, and get the women starting to come here. We've developed partners within the community to get mama kits, to work with the village healthcare team. We're developing relationships with doctors and specialists in the city, because eventually, if you can think ahead, eventually we'll be able to have dentists coming here and specialists coming, that we have screened the people so that they can see these high-risk people. We'll have all of this capacity here, and it will change lives. I love being able to do that. It's a privilege, it's a blessing to be able to give like this. I don't have children of my own. I lost my husband 7 years ago. I've been blessed in my business, and so it is my privilege to be able to help in this way, and to have this relationship to carry the Joy Center Corporation even further so we can help people in the community.
We started the construction on 28th January 2026. And as of now, we have reached 50% of construction in 4 months. This building will be working as a hospital, and we expect to finish it in October. When we moved around this community, we found there was no theater that can help the community. So we thought if we include the theater, we have helped the children, mothers and fathers of this community.
They are called Mteka. Mteka. Aha.
Oh, okay.
It serves the same purpose.
Yeah, the same purpose, but a
Yes.
different style.
Different.
So that's why it's made out of plastic. Or
This is not a plastic.
it's not a plastic.
Yeah. This
It's a
do you know papyrus?
yes. So
Yeah.
you can wash it.
Yeah, you can wash it. There's something, you have brought your tomatoes, you put there, it's like, yeah.
Yeah, do what way? Move way. No way. Yes,